this episode of Grow With Us, we are in conversation with the Vice President of Health Equity at Juno Medical, Jabraan Pasha. We discuss the newly opened Juno Medical facility in the heart of Greenwood, the Juno Medical membership and service model, and the importance of establishing trust in the healthcare system through accessibility. Welcome to Grow With Us, Jabraan. I'm super excited to have you on this episode.
Thanks for having me here. I'm looking forward to it.
Absolutely. I think it's going to be a really cool opportunity to get to know what Juno's doing in town, and also just kind of the whole story of, bringing healthcare to Black Wall Street. I think is something that I'm really, really excited to kind of dive into, and also to get to know you in a more intimate setting, like a podcast recording.
Yeah.
But yeah, go ahead and tell us your story in whatever way you feel comfortable.
Yeah, I think that's a great open-ended question. Could go a lot of ways. But I think a couple things that I think are important, especially in the context of Juno and this work, is that, I feel like I was shaped by where I'm from and who I'm from.
Yeah.
I'm from Tulsa. Born and raised, I'm a Carver, Booker T kid.
Booker T.
Yeah. And so that really made an impact on my life. I remember when I was in the 7th grade, and we had a history lesson on Greenwood and Black Wall Street. I remember that being the first time I ever heard of Greenwood, and we went to the library and went through the microfiche and looked at the newspaper from like May 31st, June 1st, June 2nd. And we noticed that there was no mention of the actual race massacre in the newspaper. Wow. And that struck me, even as a 7th grader, as how folks will really try to erase history.
Absolutely.
And so looking forward, however many years, 30 plus years later, to have an opportunity to try to rewrite some of Greenwood's history, a small part of it, has been really important. And then the other piece of who I'm from. I'm from a mother who was one of 13.
Oh my goodness.
Yeah, wow. Can you imagine, right? 13. She had 12 brothers and sisters, 9 girls. There were 9 girls and 4 boys. And I remember noticing that they were dying really young. Mm-hmm. I had an uncle that died of HIV/AIDS, probably around the age that I am now. Yeah. Stroke, heart disease, cancer, and that family that was once large, 13 is now 6.
Yeah,
and that really shaped what I care about from a health equity standpoint.
Absolutely.
And the questions that I asked were like, why are certain communities less healthy than others? And I could ask that same question about my family.
Mm-hmm. Yeah, no, you bring up some amazing points. And I think this is something I've shared on the podcast before too, but like when I first learned about Greenwood and Black Wall Street and everything that happened, it was at Booker T. It was at a place that was directly impacted historically in terms of like the events, the legacy. Booker T is a part of the legacy of Black Wall Street. I really, of course, don't want to shame education and educators too much, but I do want to say that it's too late. 15, 14. I mean, I knew enough to know that it was wrong. And obviously, like, it was very easy to see kind of what the racial dynamics were going on at the time. But I think it's interesting, even like in the 10 years it's been since I learned it, the shift from riot to massacre, that kind of context has happened. And I think that's a super important context. It actually, I think, paints the narrative a lot more reflective of how it actually happened. It wasn't like two aggressive sides. And like you said, the history, being absent, I would say like a specific perspective being completely absent from that in the newspapers, the biggest information source of the time, it absolutely allows for these narratives to spin out of control. And so, I mean, that piece is interesting. I think we'll definitely touch on kind of the Black Wall Street legacy, especially as it aligns to healthcare. And then your family, I mean, I think thank you for sharing that. It's an impactful story, and it's your story, and it's your connection to the work. And I think it's so important that we share that with other people, why we do what we do, why the opportunity to live a healthier life is the opportunity you seek to create in your work and the impact you want to make on other families' lives. So it's extremely admirable, and I'll probably continue to admire throughout this conversation.
Thank you. I appreciate it.
Absolutely. Well, you kind of touched on it a little bit, but your relationship with Tulsa, you've got Carver and Booker T in your background. I love the Hornets. I'm a Hornet, class of 2016. And, how has Tulsa been a part of your life, and kind of how has it changed?
Yeah, I grew up here. I spent my whole life here. And, to be honest, when I graduated high school, I left Tulsa not necessarily expecting to ever move back. I didn't recognize that there was a lot of innovation going on in the city. I didn't recognize that young people were moving to the city as opposed to moving away from it. And maybe I didn't recognize it because it wasn't happening, right? This was all the way back in 2002.
Yeah.
So, I left. I was gone for, over 10 years, 11 or 12 years. And while I was away, obviously I would come and visit. And I started to notice that there was an energy in Tulsa that was growing.
Yeah.
There was investment in Tulsa that had been absent. Young folks were moving back to the city. And so in, 2012, 2013, when I had to make a decision what my next step was going to be, it actually was a really easy decision to decide to come back home.
That's awesome. And what have you kind of seen in that 10 years or so since you've been back?
Yeah, I mean, at a basic level, just the development and the interest in downtown that has Tulsa feeling more like a small big city than a big small city.
Absolutely.
And groups like Tulsa Remote that are teaching people who would have never come to visit Tulsa how incredible the city is, and people are moving to Tulsa. I take care of patients every day that are new to the city, and they say, Tulsa wasn't even on my radar.
Yeah.
Then I had a chance to come visit, and they recognize how special Tulsa is, how it's a hidden gem. I think the simple truth is it's not going to be a hidden gem for much longer, right?
Yeah.
So I'm really glad to be rooted here and planted here. To see this unique resurgence on Greenwood. I'm there every day, and to see an energy there that hasn't been there for a long time, and to have a small role in joining forces with the folks that are really, really trying to reinvigorate what Black Wall Street is, while also recognizing what it was. It's really, really special to have a role in that.
Absolutely. And I think that there's so much to say about kind of these like intangibles that we're talking about, like the spirit or, this energy that these communities have. It is so easily translated into, at least I think, this inspiration that can really push the community forward. It changes from an intangible feeling to like something that is happening. It's kind of it's in everyone's mind that, we're working towards like the revitalization or the reinvigoration of a community. And I think that it's also infectious. I mean, that's the spirit of Greenwood and the spirit of entrepreneurship that has kind of started in this revitalization effort as kind of now become something that's accessible to everyone. But I think what's really important is it has to also stay true to Greenwood and to these Black entrepreneurs that we are, wanting to uplift. I think that it's really interesting kind of on the national level, like if you look at things like venture capital dollars and kind of how all of these investment vehicles eventually spend their money, it's kind of the numbers are still bad. We have a long way to go when it comes to like equity in that space, but we've seen a little bit of equity go a long way here, and I'm really excited to see kind of how that unfolds. And I think a lot of that unfolding is kind of a part of the Juno story and in some ways. So I'd really love to kind of jump right into what's going on at Juno and talk a little bit more about it. So do you mind kind of sharing with us the story of Juno?
Yeah, absolutely. And I think important to say that this story started before I was a part of Juno, but it's a very interesting story. And it has a lot to do with who we are as an organization. our CEO and founder, Dr. Kelly Henson, was doing the hard work as a resident in surgery and working really long hours, and took some time off to get his MBA during that residency, and kind of had an epiphany that his impact could be scaled much more significantly if he worked to create a healthcare company as opposed to just being a cog in the wheel. And so he pivoted and did the work to learn about healthcare and the innovation that's happening in healthcare, and really imagined this company that centered on the modern family, understanding that oftentimes it's the mother who is the quarterback for the family's healthcare, or the chief health officer for the family's healthcare, as he likes to say, and finding ways to make it easier for whoever that chief health officer is to take care of their family.
Absolutely.
And for Juno, that meant, having some accessible hours, right? The whole, 9 to 5 healthcare hours just doesn't work for most folks who work, right? So they have to take time off. They have to figure out someone to watch the kids. Well, if you have hours that are more accessible, open till 9 o'clock in many instances, weekend hours in many instances, that makes it easier for folks to prioritize their health.
Absolutely.
Right? Having healthcare teams that better mirror the populations that they take care of.
Yeah.
Right? We know from lots of research that a diverse, and I mean diverse in every sense of the word, a diverse healthcare team takes better care, literally has better outcomes when taking care of diverse patients. And so that's a big part of who Juno is. Juno really got off the ground in March of 2020. And so they became a hub of safety for Harlem during the pandemic. And we all know how rough things were up in New York.
Absolutely.
But they established themselves as being now a pillar in that community, and other communities wanted to be a part of that. So it expanded to Brooklyn. We opened in Atlanta this past spring, and now we're here in Tulsa with, I think, even a more unique opportunity than some of our other markets.
But the other locations have such an important, history to where you were and how the company started. I'm going to dive first into kind of just macro and talk about healthcare.
Yeah.
Healthcare is it's a privilege. And I don't know how we decided that was how it was going to be in America. But, I really love to hear that there are people out there thinking innovatively about, creating accessible healthcare. Yeah. It really feels like a necessity and a bare necessity at this point. And, meeting people where they're at is the easiest. It's the easiest strategy I would say it's like the easiest way to meet those people and to fill those needs. Because like you said, that 9 to 5, like, I don't know. I'm supposed to take off work to go get just to meet my doctor. It really makes it a barrier. It creates an unnecessary barrier. And then especially for, like you said, for the modern family where, that is multiple schedules being juggled at one time. Kids got this, but they've also got a game at 6. So, they've got it. It just becomes really, in a society where we also expect women to work, if women are the primary caretakers, it becomes an impossible task. So this is a shout out to every woman out there, every mother. We applaud you, and it is no joke or no game. But I really just love that. That's kind of how the framework is thinking about the people that are essentially delivering the healthcare to the people that they care about and their family unit. Obviously also centering themselves and creating an opportunity for, primary caretakers in the homes to be seen with the same convenience and the same care team that treats the people they care about. I think that that's an interesting part of the model too. And then lastly, I think you guys have expanded in some really targeted geographies. Harlem being, I would say, a predominantly Black and Latino like serving community, and then also Atlanta having like a huge Black population. I think it's no it's no mistake that you guys opened up in places where your impact would be great, and serving the populations that are typically underserved in healthcare. And this is a little bit of a weird pivot, but one of my first years in college, I learned about the Tuskegee experiment that happened, and it's such an interesting and tragic, and God, it just makes you hate. It makes you hate so many things. But it actually informed me so much about I would say like the Black community's response to COVID, and mistrust of like American healthcare systems, and for absolutely valid reasons. For absolutely, like, we aren't going to get done wrong twice in this way. And it's so bizarre to think that there's this history, this ugly history of folks of color being exploited medically. And so I think that this opportunity to be a community that represents that is made up of community members, Black folks, people of color in the medical profession, like serving their community, it's allowing for the levee to break a little bit and reestablishing that trust. But it's going to be a long fight.
Yeah, I completely agree. And when we have conversations in healthcare about the mistrust that exists in many communities of color.
Absolutely.
The first thing you have to do is do what you just did, and acknowledge that there is lots of good reasons for this mistrust.
Yeah.
It's earned mistrust.
And
it's on us, meaning us in healthcare, to try to foster trust. And I wouldn't even say regain trust, because trust was never there.
Yeah.
Right? We know that healthcare was not built for marginalized people.
Yeah.
It wasn't built for folks of color. It wasn't built for LGBTQ plus folks. It wasn't built for poor folks. And so it's a square peg, round hole sort of thing, right? Yeah. And we've got to change things on our end and not expect other communities to adapt to healthcare. And that's essentially what we're trying to do.
Absolutely. Which, again, I love that. I have such admiration for the mission and the work that's going to be done. It's kind of like whittling away at the mistrust, the earned mistrust, like you're saying. Like, it is not going to happen. One breakthrough isn't going to change the whole system. I think we've known that, and there's countless examples. But earning that trust one by one, and earning that, I think also just like people get to choose who provides them healthcare, and I guess that is also the trust. But where are people going to put their money? If we are going to run this whole healthcare system off of money and capitalism, and it's got to be something where everyone's fairly compensated on the delivery side, like, that choice matters. And that choice matters for every single family, especially when it comes down to how many people are being served. So it's really interesting. I think there's so many facets to discuss here. One thing I specifically want to go back to is this location piece, because I think that I was at your opening for the Tulsa location, and it was really magical. Honestly, I remember reflecting. I showed up alone, which is something that happens with me a lot.
Nothing wrong with that.
You got to just show up,
yeah.
And I think it was really impactful to kind of experience what the energy was like. It was essentially a block party with an open door into the clinic, and wow, you guys have built a beautiful clinic in there. And I'm just, upon my like reflection of the event and everything, like the impact that this is going to have and the impact that it's already have is, like, I think palpable. And I think, just for some context for listeners and viewers, like, specifically, I would say, and you might frame this differently, but for me, where Juno is located right now is where, ever since I've been a Tulsan, which almost 15 years now, it is absolutely in the heart of where modern Greenwood is. Historically, Greenwood is way, way broader, way more expansive. I mean, where we're at right now in this studio would, I think, be considered Greenwood, 100 years ago back then. But it's in the heart of where it's right next to Greenwood Rising. It's just approximated in such an amazing location. Yeah. So I'd love for you to kind of tell me about the thought behind that and the impact.
Yeah. Oftentimes I get questions, being from Tulsa, being familiar with Greenwood. I get questions about, why Greenwood? And my answer is it had to be Greenwood.
Yeah.
It had to be Greenwood. I cannot imagine any other location that could provide all the things that we're providing, right? It goes beyond just the brick and mortar, right? It's the energy of Greenwood, the essence of Greenwood, the historical significance. It had to be Greenwood. Yeah. And you're right. We're in the heart of Greenwood. We have a healthcare center that is somewhere adjacent to where Dr. A.C. Jackson was Greenwood's physician, over 100 years ago. Unfortunately, he was killed in the race massacre. But to know that healthcare has not been a part of Greenwood's story for 50 plus years, it needed to be Greenwood. And to be completely honest, I don't know if it would have been as much as I love the mission, for me to take this job, I think it had to be Greenwood for me too.
Yeah.
It's a special place. It's to be able to walk around and down Greenwood every day and talk to people. They needed this. Yeah. They needed this. And you saw at our opening, which absolutely was a block party, how excited the community was, how people came from all over to Greenwood. And I think that's important because we've talked a lot about this being designed for this community. I think one thing to keep in mind is that if you design healthcare for those who healthcare has overlooked forever, then you can take care of everyone. Yeah. And we've seen that. Most days I can walk into our space and see someone I recognize as, a C-suiter sitting next to someone who is on, Sooner Care. Yeah. And they all know that they're getting the best care possible. And so it really has to work that way. You can't design healthcare for the top 1% and expect it to work for everyone. Yeah. But you can design healthcare for literally for everyone and marginalized groups and expect it to work for everyone. Yeah,
I think that that's such an important point because I think that there's some people that already, and I guess I would say myself, and not to overgeneralize, but for me, I think that, based on my socioeconomic status or based on what I've heard, or how I've heard LGBT folks are treated in medical, there are certain things that I self-select myself out of when it comes to divulging information in a medical setting. I'm scared of stigma for maybe speaking about the way that I, it just creates these unsafe scenarios where you're not able to divulge your full medical history or your full your full medical history in order to receive the best care possible, because you've heard, everyone's heard the horror stories. Someone has shared an instance where they were invalidated for their concern, and then worst case scenario happened. And I hate that has happened countless times over again, that it creates a conditioning for all of us to think that we deserve less than, or think that that's the quality of care we're going to get because that's the quality of care we can vouch for. And so I like that there's an element of this equity piece that you're talking about where it's going to empower folks to, I think, want more for themselves and be able to ask for that, to be with trusted providers, to be with folks that you're in community with. I think that's an important point you talked about too, being in a space where you might know the person that is, know them more than just in their professional sense of in their professional self. So, excuse me, there's so many things that are so important in this conversation. And I think you touched exactly on the Greenwood piece. I think it would have had to be Greenwood for me too, in terms of the mission and the location. It has to be that big impact. It has to be that righting of wrongs when we have the opportunity to do so. We have the backing, we have the tech, we have the people. That combination of forces is so strong, and so it has to be that concerted effort. Let's talk a little bit about kind of like how Juno works in terms of like receiving healthcare. And I think another thing that I'd love to kind of dive into too is this partnership with Tulsa Remote, which I find really fascinating too. So go ahead and tell me a little bit about both of those things.
Yeah. So I think what is unique about Juno is that we really modernize healthcare, but not to the point where it feels cold, right? Healthcare really has to adapt with the times, and for us, that modernization means making it really, really easy to make an appointment. Right? You don't have to call and wait on the phone for minutes to make an appointment. You literally can hop on Juno.care, pick the clinic you need to go to, look at all the providers, read about them, pick which one you think you may feel most comfortable with, and then look at their calendar and pick a time. And that time may be 2 hours later, right? Yeah. We're pretty good about getting folks in. The way we communicate with our patients is really unique. We have a portal where you can hop on there and send me a question. And if it's not something that I need to have you come to the office for, you don't need to come to the office. I'll answer it right there, right? You can send prescription refill requests all through this portal. And so it just streamlines this process. That whole headache of just navigating healthcare, I think, is reduced quite a bit. And we have, I think, one of our biggest, secrets is the same-day care clinic. Which we equate to urgent care. Traditional urgent care, you don't feel well, you drive to the nearest urgent care, you're in a lobby full of people, and you don't know how long it's going to take. It may be 30 minutes, it may be 3 hours, and it's just a mess. Yeah. Right? Well, in same-day care, with Juno, you hop on and you make an appointment just like you would with your primary care, and we can get you in that same day. So, hey, it's 8 a.m, you hop on, hey, I want to be seen at 10 o'clock. You grab a 10 o'clock appointment, and you come in a few minutes before, ideally. You're seen at 10, you're out of there by 10:30, and you go on and about your day and spend the rest of your day at home if you need to, right? So that convenience, I think, brings a lot. We also have kind of a spectrum of payments that we take. We have patients who are self-pay, and we adjust our prices to accommodate for that, right? Because healthcare can be really expensive. We have patients who are on Medicaid. We have patients who are on commercial insurance, and we take almost all of the big commercial insurances. We even have some membership models, and this is where our partnership with Tulsa Remote came into play. We have a Juno membership that we call is kind of like a basic membership. It's somewhere between $15 to $20 a month. Folks can get free virtual care. That's the other thing that makes us unique. Yeah. You don't always have to come into the building to be seen, right? And so folks can have a virtual visit. They can see their doctor's face. Their doctor can see their face, and they can talk about their issues. And so with these memberships, that's allowing us to really broaden our reach. We can take care of folks who are outside of Tulsa as well because they can use the virtual platform. Tulsa Remote has been a wonderful partner. They are really valuing the health and wellness of the new Tulsans that they're bringing into the city. And one way that they want to do that is to make sure they have access to high quality health care. And so Tulsa Remote was amazing enough to say, hey, Juno, what can we put together to guarantee that the new folks that we're bringing have that? And for us, that was, we have this membership. Maybe we can partner there. And so Tulsa Remote is covering the monthly Juno membership for all of the new Tulsa Remoters that are coming into Tulsa, which may be up to 1,000. Yeah. And they're starting to come through the clinic, and they have this membership that allows them free virtual care. It gives them a few other perks. And so that has been wonderful to meet all these new Tulsans. But the good thing is that membership is available to everyone. Yeah. So whether you're a new Tulsan or you're born and raised in Tulsa like I am, you have access to this membership. But I think what is even more important to mention is that the care that someone receives has nothing to do with it if they have a membership or not. Yeah. member or not, you're going to get the best care available from amazing clinicians, and we have wonderful ones. We can take care of adults. We can take care of kids. We can take care of older adults. We can do women's health things. We can do urgent care needs as well.
Yeah. Yeah, the spectrum of service providing is really important, because I think that's something that I've come across in like navigating the like modern medical field is like you need to have a primary care, but anything beyond like, I don't know, your primary care can see for quite a bit of things, but like if you need any type of specialty, then you end up talking to like 4 or 5 other people, and it's like, but I don't know you guys.
Yeah.
Like I've never met you. It's such a bizarre experience, because you're like just being triaged out. And I don't know, like I've never sat in a conversation with like my primary care and whoever I was triaged out with. It's like, is there any communication going on here? I don't know, and then I start to tell the story differently, and because it's affecting me differently as the time goes on. It's really bizarre, but I love talking about the model and the accessibility of the model. I find it extremely fascinating and like very empowering. So I really hope that if you're listening or watching, like, and you're in Tulsa or not in Tulsa, have access to a Juno facility, like please check out their services and see if it's something that would work for you. I really think that they're doing something to change how we navigate the healthcare system in this country, and for the better. And yeah, please check it out. And I think it's a really important thing you touched on with the Tulsa remote part is like, there is an organization that is like valuing the health and wellness of new people. It's not just about come to Tulsa and here's your $10,000. It's come to Tulsa and we want you to experience life differently. We want you to experience, what accessible healthcare is like. I know that's always, anytime you move to a big city or a new city, you got to change providers, because if I were to go somewhere else, I'd have to get a new PCP. And that is something that I've actually heard from so many adults that like they just like never take on that task.
Yeah, if there's just one too many barriers, everyone has that additional barrier to where they would say, you know what, it's just not worth it.
Yeah.
And we want to remove as many of those barriers as possible.
Absolutely, which is amazing. We'll round out this discussion a little bit with kind of, what has the response been to Juno here in Tulsa? How have you seen the community react?
Yeah, it's been amazing. I've had numerous conversations, and I know my colleagues have as well, where patients say, "No one has ever asked me that." Thank you for asking that question. We have so much positive feedback on how warm and welcoming our whole team is. And that has to be from the beginning, right? The first person you see is the first impression you have about a place, right? And so from our receptionists to our back office to our clinicians, we've just got incredible feedback about our kindness and our openness and how well we listen. That feedback has been incredible. One thing that I also hear almost daily is that this is the most beautiful clinic I've ever been in. Yes. And I've been in healthcare for a long time, and it is the most beautiful healthcare space that I've ever been in, and I get to work there. And so, we've designed this clinic to not feel like a clinic.
Yeah.
You look at a picture, you say, is this an art gallery or is this a healthcare center, right? Mm-hmm. That has been really good feedback, and we want the folks of Greenwood, we want the folks who come from wherever to get care to feel like they deserve that kind of high quality facility. And we need that to mirror the high quality care that folks are getting. And I've had so many people say, hey, I just never had a doctor.
Yeah.
Right. And that feedback has been amazing. I've had many people who have come in to see me or my colleague, Dr. Upton, and say, I've never had a Black doctor. Right. And so the feedback has, I think, reaffirmed our need. It has reaffirmed that it had to be Greenwood. Yeah. It has reaffirmed that this is going to be a really successful organization, and that we have a model that can not only work here, because if it can work here in Tulsa with our history, it can work anywhere.
Yeah, absolutely. No, I really appreciate hearing that feedback. And I think it's so important to talk about, like, never having a Black doctor or never having a doctor. That's the breakthrough, like, for so many things. And that's the health equity that I love to see happening, and I love to know is happening just down the street. It makes me so happy to live here and so happy to be a part of a community that is trying to address the inequity and meet it with actual equity instead of these Band-Aids or, this roundabout way of, making it feel like it's something, but it's actually something else. I mean, it feels real and genuine, especially hearing your story. And then also those sentiments are not coming from nowhere. They're coming from real people having these experiences that are novel and unique and impactful to their lives. And that's amazing. It's kind of how it should be. This has been an amazing conversation, Jabraan. I really appreciate you being on here and telling me and all of our listeners kind of about what's going on with Juno and what's going on in Greenwood. Is there anything else you'd like to bring up to our listeners, or ways to either get in touch with Juno and anything? Yeah,
for sure. I just want you all to know where we are. We are directly south of Greenwood Rising. Our address is 21 North Greenwood. You can't miss us. Our website that I absolutely think is worth checking out is juno.care. You can learn about our mission. You can read about our leadership. You can read about all of our clinicians, and you can make an appointment. We'd love to take care of you. And if you're in the neighborhood, just pop in and take a look and see how welcomed you feel, and if you feel comfortable, we'd love to take care of you.
Awesome. Thank you so much, Jabraan. I really appreciate it.
Yeah, absolutely.
Thank you for listening to this episode of Grow With Us. Grow With Us is supported by In Tulsa Initiatives. If you are interested in learning more about In Tulsa services for job placement and workforce development, please visit talent.intulsa.com. From there, you can join our talent network, where you will get access to our newsletter, and our talent team will make sure you put the right opportunities on your radar. We put the choice to pursue a new career and opportunities in your hands. Be sure to subscribe on Apple Podcasts and Spotify to be notified when more episodes of Grow With Us are released. Let us know what you think about how we're doing by rating and reviewing. It really helps. Grow With Us is edited and engineered by Rant9 Productions and Jesse Ulrich. This has been Grow With Us.